So talk a little bit about various techniques. Just off the top, MIS versus open. I think there's no further argument here. Open is worse operative parameters, greater operative time, more blood loss, and they do poorly as compared with MIS techniques. And you don't really see very many open techniques done anymore. With this, I want to just give a very, very brief history, talk a little bit about techniques, complications, talk about the complications as it relates to the differences in techniques. So this collection of things I've done over the time, we used to fuse the SI joints with partially threaded 7mm machine screws. And those worked great until they backed out. And then we put them in with fully threaded screws. And it took a little bit longer until they backed out. We put them in with cement. And then the triangular titanium bars came around about 2009. I think I did my first case then. And then I really like the 3D printed screws when that came around about 2014, 2015. I did a few cortical allografts, intra-articular distraction arthrodesis. I do about 2 or 3 a year now, and these are mainly problem solvers for me. They're not my go-to. Although seems to work okay. They're just not my favorite approach. So we talked about the lateral approach, and it goes through the gluteal muscles. There's maybe a little bit of controversy about that, but I think these are safe, and it's done with soft tissue dilation, and it doesn't really cause the AEs on this are very favorable, as you will see. I'll show you some data on that. Posterolateral approach is nice. Pelvic inlet, pelvic outlet. You go posterolateral, gluteal sparing, pretty good. Then you have the posterior approach.